She was already running toward the sound when the others were still deciding whether to move. The crack of the impact had come through the east corridor wall like something tearing open, not an explosion, not yet, but the kind of sound that precedes one, low and wrong and final. And while the attending physicians in the trauma bay stood motionless, staring at each other above their masks, while the charge nurse reached instinctively for the wall phone, while everyone around her paused to calculate the risk, Lenora Voss was already gone. Nobody noticed. That was the thing. Nobody noticed because nobody was watching her. That was the story of Lenora Voss at St. Edmund's Regional Medical Center in Burlington, Ontario. Nobody ever watched her unless they needed something filed. She had come to St. Edmund's 11 months ago, quietly, the way a stone drops into water without announcing itself. 32 years old, medium height, the kind of face people forget in a hallway. She wore her dark hair pulled back so tight it gave nothing away. She carried a second-hand badge holder and a coffee thermos with a dent in it. Her references were in order. Her nursing registration was current. Her prior employment history, 2 years at a clinic in Thunder Bay, was unremarkable enough that no one looked further. The unit manager, a compact and efficient woman named Gretchen Moreau, had interviewed her for 12 minutes. She'd hired her because the evening shift was short 2 bodies and because Lenora had looked at her steadily throughout the interview without trying to impress anyone. "You've been out of acute care for a bit," Moreau had said, looking at the resume. "How do you feel about jumping back in?" "I'll manage," Lenora had said. Moreau had almost smiled at that. What Lenora Voss did not volunteer and what Moreau did not ask was where those 11 months between Thunder Bay and Burlington had gone, or the 4 years before that, or the deployment before that, or the one before that. She had a small apartment on Plains Road. She kept irregular hours. Her neighbors described her, when they thought to describe her at all, as quiet. The trouble at St. Edmund's had a name, and the name was Dr. Callum Featherstone. He was 47, tall, the kind of tall that takes up room in a conversation, with the easy confidence of a man who had never once questioned his own competence and had never been given cause to. He ran the emergency department the way some men run a dynasty, with the implication that everything good within it had come from him, and everything imperfect was the fault of someone hired after him. He was not a bad doctor. That was the complicated part. He was actually a good doctor, and he knew it, and he had decided at some point that knowing it entitled him to treat everyone around him as a variable degree of lesser. The nurses he categorized quickly and permanently. Moreau he tolerated because she kept the floor running and he knew it. The experienced staff he worked around, grudgingly. The newer ones, the contract staff, the probationary hires, he simply didn't see. They were furniture to him, useful when needed, ignorable otherwise. Lenora he had categorized within her first week. "Who ordered this draw?" he'd asked at the nursing station one afternoon, holding up a chart. "I did," Lenora said. She was charting 2 seats down. He looked at her for a moment. "And you are?" "Voss evening shift." He set the chart back down. "Get someone to countersign that." She had looked at him calmly. "It doesn't require countersignature." There was a pause, the kind that has weight in it. "Get Moreau to look at it anyway," he said, and walked away. That was the first interaction. There were others. None of them were dramatic. None of them were the kind of thing you could report exactly or point to and name. They were the accumulation of being looked through, being talked around, having your clinical assessments questioned in the quiet ways that leave no evidence. A raised eyebrow, a redirected question, a patient who asked for the real nurse. Lenora absorbed all of it without comment. She came in, she did her work, she left. She ate her lunch alone in the break room and read, or looked at her phone, or sometimes just sat quietly with her eyes slightly unfocused, the way people do when they're somewhere else entirely inside themselves. The other nurses on the floor had a range of theories about her. Tamsin, who had been at St. Edmund's for 9 years and had opinions about everything, said Lenora was probably burned out from somewhere else and just going through the motions. Chetna, who was kinder, said she seemed like someone carrying something heavy. Reuben, the evening charge nurse, said he didn't have a theory because theories required information, and Lenora Voss didn't give anyone information. What they all agreed on was that she was good at the work, precise, efficient. Not warm exactly, but not cold either. She was simply concentrated, like all of her attention had been trained into a fine point and nothing was wasted. Patients liked her, which surprised some people. She wasn't chatty, but she was present in a way that some of the chattier nurses weren't. She remembered things. She didn't need to be told twice. Featherstone, for his part, had settled into a comfortable position of treating her as a procedural inconvenience. He occasionally used her name correctly, and occasionally didn't bother, which was its own kind of statement. The probationary one, he'd said once, to another physician, within earshot of the nursing station, she filed the wrong form for the Hendricks referral. She hadn't. The form was correct, but the other physician hadn't known that, and Lenora, who had overheard, had said nothing. Chetna had looked at her afterward, silently asking. Lenora had shrugged. The kind that means, it's not worth it right now, but something in her eyes said she'd filed it away. The morning the east corridor wall opened up, it was a Thursday in late October, and the hospital smelled the way hospitals in October always smell, of industrial cleaner and recycled heat, and the first cold coming in around imperfect door seals. Lenora was 40 minutes into an 8-hour shift. She had triaged a man with chest pain, restocked 2 crash carts, and was in the middle of updating medication records when she felt it, not heard. Felt, a subsonic vibration. Low through the floor, like a large truck passing very close, but there was no truck. The building held it for a half-second, and then the sound arrived, catching up. She was out of her chair before the overhead lights flickered. Later, when she tried to explain this to someone who asked, she said, "You learn a pattern. The sound and the feel don't come in the same order in a building as they do outside. Once you know that, you can't unknow it." The someone who asked didn't entirely understand, but they wrote it down. The east corridor served a maintenance wing and a small administrative annex. Low traffic at that hour. The wall had partially buckled inward near a junction box. Dust was still moving in the air when Lenora came around the corner, and the smell hit her before the visual registered properly. A chemical sharpness that she identified before she'd consciously decided to identify it. A gas line. Ruptured. Not the blast itself, but the secondary condition that preceded one. She stopped, assessed. 4 seconds, no more. There was a man on the floor near the junction box. He'd been thrown or fallen, impossible to say which. Mid-40s, maintenance uniform, conscious but disoriented, reaching for something that wasn't there. His right arm was bent at an angle it shouldn't be. His breathing was labored but present. She moved toward him. "Stay still," she said. "I'm going to check your head. Don't move your neck." He looked up at her. His eyes were having trouble focusing. There was a, "I know. Don't talk yet." Behind her, she could hear running footsteps. 2 staff from radiology, a security guard. They stopped at the mouth of the corridor, uncertain. The gas smell reached them. "We need to call the," one of them began. "Call it in," Lenora said without turning around. "Get maintenance to the east shutoff. Keep everyone back 20 meters. Someone page Dr. Featherstone in the charge. Are you 20 meters?" she said again. She had the man's collar palpated before anyone argued further. C-spine intact, possible concussion, radius fracture, right arm, clean from the look of it, not compound. She checked his pupils, equal and reactive. She pressed 2 fingers to his wrist and counted. "What's your name?" she asked him. "Bernard," he said. "Bernard, I'm okay. I think I'm—" "You're okay," she said. It was not reassurance exactly. It was information. "You're going to stay still and let me work." "What hurts most right now?" "My arm." And he winced. "My ribs, maybe right side or left?" "Right." She pressed carefully. He hissed. She moved her hands. "Possible rib fracture right side," she said, more to herself than to him. "Breathing is intact. We're going to keep you from moving until we can get a board under you." "The gas," Bernard said. "I don't know what, something hit the line. I couldn't see what. There was a noise first. Before the wall?" He looked at her. "Yeah, before." She held that. Featherstone arrived at the 20-meter mark with Moreau at his shoulder, and he took in the scene with the kind of rapid professional assessment that he was genuinely good at, and then he took in the person crouched in the corridor with the patient, and something shifted in his expression. "Voss," he said. "Dr. Featherstone, look up. Possible concussion, right radius fracture, possible right side rib fracture. He's stable, breathing is good, pupils equal and reactive. We need a board and a collar before we move him. The gas line is still active. Maintenance needs to have the east shutoff done before we bring a gurney through." Featherstone opened his mouth, then closed it. He looked at Moreau. "Shutoff?" "He's done," Moreau said. She was watching Lenora. "Get a team in there," Featherstone said, straightening up. And he gestured at the corridor. Get Voss back here. She has the patient stable," Moreau said. "I'm aware of that." His voice was tight. "Protocol says I'll come out when maintenance clears the line," Lenora called evenly. "Bernard, keep looking at me. What year is it?" 2024, Bernard said. "Who's the Prime Minister?" He made a face. "Don't remind me. That's a good sign," she said. Someone, somewhere behind her, let out a short and involuntary laugh. The gas line was cleared in 11 minutes. Lenora walked Bernard out on the board herself, monitoring his breathing the entire length of the corridor, one hand on his wrist. She handed him off to the trauma team with a complete verbal report. Mechanism of injury, assessment findings, vitals trend, her concern about the right side rib fractures and potential pneumothorax given his respiratory pattern. The trauma physician, a woman named Dr. Ogilvy, who had been at the hospital for 2 years, listened to all of it. Then she said, "Good catch on the pneumo. We'll image right away." Lenora nodded and stepped back. Featherstone had watched this from the edge of the trauma bay. He hadn't intervened during the handoff, which was unusual for him. His face was doing something complicated. Moreau appeared at Lenora's elbow as she was washing her hands. "You okay?" Moreau asked. "Fine." Lenora looked at her own hands under the water. The gas smell will clear by next shift. Bernard should be in imaging by now. I meant, are you okay? Lenora looked up. Yes. I'm okay. Moreau studied her for a moment. The ribs, you were checking for more than a fracture. The sound he described. Something hit the line before the wall buckled. That's not a mechanical failure pattern. Moreau was quiet. You should tell security to pull the East Corridor cameras, Lenora said, and check the maintenance log for who had access this morning. I was going to, Moreau said carefully. I'm also wondering how you knew to check for that. Lenora dried her hands. She didn't answer immediately. Then she said, I've seen what things look like when they're made to look like accidents. She said it simply, without drama, the way you say something you've had to explain before and have simplified over time. Moreau looked at her for a long moment. Voss, what did you do before Thunder Bay? The pause was brief, but it was there. Different things, Lenora said. I should get back to the floor. The cameras confirmed it within the hour. Not a mechanical failure. A device, crude, the security consultant said, but deliberate, placed against the junction box to rupture the gas line and initiate a secondary ignition. The primary element had malfunctioned, which was the only reason they were having this conversation standing up. St. Edmunds was a regional center. It served 6 communities and housed on any given day the kind of patient population that most hospitals in larger cities didn't see. Remote cases transferred in, individuals from communities without access to specialists, a dialysis unit that served patients who drove 3 hours each way. It also housed, in a secure ward on the 4th floor, 2 individuals awaiting transfer to a federal facility under a court order that had been contested in 2 provinces and covered in every outlet that covered anything. Lenora had known about the ward. She'd noticed the security configuration when she first arrived. She'd noted the shift change patterns, the checkpoint times, the days the transfers were scheduled. She'd noted this the way she noted everything, quietly, without comment, filed away behind the dent in her thermos and the tight pulled-back hair and the unremarkable face that people forgot in hallways. She had not told anyone about this. There had been nothing to tell until today. Now she went to Moreau's office, closed the door, and told her. She told her about the gas line placement and what it suggested about the intended sequence: rupture, secondary ignition, structural compromise, evacuation chaos. She told her about the ward on 4 and the transfer schedule and the likely window. She told her calmly and without preamble that in her assessment there was a second phase and it hadn't happened yet. Moreau listened to all of this with her hands flat on her desk and her expression very controlled. Voss, she said when Lenora had finished. Who are you? I'm the evening nurse, Lenora said. Before that. Another pause, shorter this time. Before that, Lenora said, I did a different kind of triage. They brought in the RCMP, a unit that didn't advertise itself. 2 people in plain clothes who arrived in an unmarked car and spoke to Moreau in her office with the door closed, and then spoke to Lenora, also with the door closed, for considerably longer. Featherstone was not in the room for any of this. He was in the emergency department doing his job, which he continued to do well, and he knew something was happening but not what, because nobody had thought to loop him in, and for once this did not appear to bother anyone. The RCMP consultant, a compact woman with reading glasses pushed up on her head, listened to Lenora's assessment of the secondary phase, with the careful attention of someone who knew how to listen to operational information. You think the target is the transfer itself, she said, not the building. The building was the distraction, Lenora said. Evacuation protocols would have moved the 4th floor patients to the west lot. Transfer vehicles would have been rerouted. It's a cleaner window than a direct approach. And you know this because it's what I would have done, Lenora said. A pause. 12 years, Lenora said quietly before the question arrived. 3 rotations. Kandahar, then a forward operating base I'm not going to name, then a role I'm also not going to name. I came home. I needed something that was still medicine, but that wasn't. She stopped, started again. I became a nurse. I'm good at it. The consultant took her glasses off her head and turned them over in her hands. The Thunder Bay Clinic, she said. Legitimate, all of it, I know. I checked while you were talking. She said this without apology. What do you need to make the west lot secure? Lenora told her. The second device was in the wheel well of a contractor's vehicle that had been in the lot since 6:30 that morning. It was found at 14 minutes past 2 in the afternoon, 11 minutes before the altered transfer window that Lenora had suggested, and that the RCMP had agreed to, without explaining why to anyone who didn't need to know. Bernard was in imaging with a confirmed right side rib fracture and no pneumothorax, which Lenora had considered a lucky outcome. The 4th floor patients were transferred without incident via a different route at a time that had not been disclosed to anyone outside a group of 7 people, of whom Lenora was one. The contractor's vehicle was not, in fact, a contractor's vehicle. She was charting at the nursing station at 3:15 when Featherstone walked past. He stopped. She could feel him stop before she looked up. Voss, he said. She looked up. His expression was doing the same complicated thing it had done in the trauma bay. It was the expression of a man who was recalibrating and finding the process uncomfortable. The gas line situation this morning, he said. Yes, you moved fast, yes. He stood there for a moment. The nursing station hummed around them, keyboards, monitors, the low intercom drone. He looked like he was working towards something and finding the approach difficult. You assessed well, he said finally. The patient, the maintenance worker, you assessed him well. Thank you, she said. Another pause. I wasn't aware, he said, that you had, he gestured vaguely, which was unusual for a man who was normally precise. That kind of background. You didn't ask, she said, not unkindly, simply. He looked at her for a moment longer. Then he nodded, a short, deliberate nod, and walked away. It was not an apology. It was not a transformation. It was a nod and a walked away from, and in the context of Callum Featherstone, Lenora understood it to be as close to both of those things as he was capable of producing on a Thursday afternoon. She watched him go. Then she looked back at her screen and finished the chart. Moreau found her in the break room at end of shift, her thermos in her hand, her jacket on. The RCMP want to debrief you formally tomorrow, Moreau said. 9 a.m. I know, they called. Moreau sat down across from her. The break room was empty. The overhead fluorescent light buzzed faintly, the way fluorescent lights in break rooms always did in every building, in every city, everywhere Lenora had ever rested between things. The unit manager position, Moreau said, evening shift. I've been sitting on it for 2 months because I couldn't find the right person. Lenora looked at her. I'm still looking, Moreau said carefully, but I thought I should mention it existed. Lenora looked at her thermos, the dent in the side of it. She'd gotten that dent in a forward operating base in a province she'd been advised not to name, and she'd kept the thermos for 11 years because getting rid of it had never felt right, and also because it still worked. I'd need to think about it, she said. I know, I'm not, she paused. I'm good at the floor. I know the floor. You're good at a lot of things, Moreau said, most of which you apparently don't mention. You didn't ask, Lenora said again, the same words she'd said to Featherstone, but softer now, and with something almost like a smile at the edge of them. The kind that doesn't quite surface but changes the light in a face. Moreau stood up. Think about it. I will. Moreau walked to the door. Then she stopped. Voss, that thing you said earlier. About seeing what things look like when they're made to look like accidents. Yes, does it? Moreau paused, choosing the words. Does it go away, seeing it that way, after enough time? Lenora thought about this honestly. No, she said, but it gets quieter. And sometimes it's useful. Moreau nodded once and left. Lenora walked out through the main entrance at 3:47. The October air hit her face. Cold now, the kind of cold that meant November was already leaning against the door. The parking lot was lit in orange-yellow, and the trees at the edge of the property had lost most of what they'd been holding on to. She stood for a moment in the cold. She thought about Bernard, who was probably sleeping now with his arm in a cast and his ribs taped, and who had looked up at her with unfocused eyes in a hallway full of chemical-sharp air and trusted her without knowing a single thing about her, which was the version of trust she had learned to count on and had come to prefer. She thought about the ward on 4 and the unmarked car and the console's reading glasses and the 11 minutes, and how 11 minutes was a long time when you knew what to do with them, and no time at all when you didn't. She thought about the nod. Featherstone's nod. The uncomfortable recalibration of a man encountering information he'd decided in advance wasn't there. She thought about what Moreau had asked. Does it go away? The answer was no, and the answer was also, it brought her here to this parking lot, to this hospital, to this floor where she was good at the work, and where nobody watched her unless they needed something filed, and where that invisibility was sometimes a problem, and sometimes, on a Thursday in October, the only reason everyone was still standing. She turned up her collar against the cold. She walked to her car, got in, and drove home through the orange-lit streets of Burlington, and the city moved around her in its ordinary Thursday way, indifferent and intact.